Let me thank everyone for joining us this morning. It's now been 3 months since we issued our first stay-at-home order for the city. In that 3 months, we've all experienced a radical shift in how we conduct our lives. Before I get rolling into this, let me thank the people who are going to be with me this morning to help answer questions and further our conversations. First, to my right, Matt Mueller, who is our Director of the Emergency Operations Center, Bob McDonald, who is our Public Health Administrator for the City and County of Denver, and Dr. Sarah Rowland, who is with Denver Health and Hospitals. Thank you for joining us this morning. During these 3 months, for many, it meant working from home while their kids were remote learning. Many others who had to face this pandemic straight on while still showing up for work saw their workplaces and their interactions transform. Many people lost their jobs or were furloughed. And all of us had to cope with not seeing our friends, family, and neighbors except through computer screens or behind glass. But we've also seen how we as a community can pull together to support one another through something that no one else has experienced in over a century. And I just want to remind everyone that if we were at a Broncos game, we would still be in the first quarter. COVID-19 may have pinned us up against the 1-yard line back in March, but it's taken everyone while we're on that 1-yard line to get us at least moving forward to where we now sit on the 20-yard line. Today, we're seeing some positivity based on our efforts. Our positivity rate is stabilizing and staying low. Hospitalizations continue to trend downward, and we're doing more and more testing and contact tracing. But we know how quickly this virus can reemerge and how reopening too quickly could put us right back to where we were. And all you have to do is look at states like Texas and Florida to get examples. Other examples, we're getting numbers from Memorial Day weekend, and with people starting to go out and interacting with others again, there is an uptick in cases here in Colorado. I say we're only on the 20-yard line because we're all seeing what's happening in other states, especially neighboring states to Colorado, with dramatic rises in their positivity or positive counts because they didn't take the steps that our city and our state took at the start of this pandemic. What we're seeing isn't really nearly as bad, but it doesn't mean that we still won't see a rise in cases again here in Colorado. I don't want to see us, just like I don't like to see the Broncos lose yardage, I don't want to see us lose yardage as well through this effort. So we'll need to keep doing our part to push back against this virus. Keep wearing those face coverings where it's required, even when they're not required. Keep maintaining physical distancing of 6 feet when you're out in public, and don't gather in large groups of people. And keep doing the little things like washing your hands regularly. We've had a few folks email into the office recently to ask when the face covering order is going to be lifted and what metrics we are using to decide. The answer to that is this: wearing a face covering is something people are going to be doing for the foreseeable future here in Denver. COVID-19 is still in our city and will be for a while. And since we don't know where it is without people getting tested, that means our face covering order will be in place for a while. That's our ground game. The ground game is working right now in Denver, and it's everyone's responsibility to keep working. Our passing game continues to be testing and contact tracing. Regardless of what some people think of the amount of testing being done in the United States, I don't take it as a joke, and no one up here does. Our country isn't doing enough, and we need to do more. We need to do more of it, and we need to make sure there's a national strategy around it. For a population our size, we need to do 150 tests per 100,000 people per day, which is an average of 1,100 tests per day. I'm proud to report that on average, we met that mark now for the past 2 weeks. I can't underscore enough how critical it is that we keep meeting this mark. The governor and I discussed just recently how we can continue this testing at the Pepsi Center. As you all know, we have been offering free testing for the entire metro region at our Pepsi Center site for both symptomatic and asymptomatic folks. We partnered with Denver Health and several community organizations recently to hold community testing days in our underserved neighborhoods, which we need to do more of, and we're going to work to strategize to do that. And our wellness winning, put together by our Department of Public Health and Environment, continue to take appointments for those who have access issues when it comes to getting to the testing site. There is a bit of good news. A 5% or below positivity rate for testing is the state's target for where we want to be if we want to continue opening up as a state. Our positivity rate right now stands around 3%. And our contact tracers have already made over 2,200 calls to people who have potentially been exposed to positive cases or may have been exposed to positive cases, with around 1,200 people being reached in the first attempt. Those are encouraging signs, and it means that we've got to hold fast and really buckle down on what we're doing to stay ahead of this virus. We're going to continue to try to keep on going so that even with the background noise. So listen, we want to continue to be successful. If we're going to work to stay ahead of the virus, we've got to continue increasing testing and contact tracing, keep our hospitalization rates down and positivity rates low if we're going to continue to align ourselves with the governor's plans to open up the state. If we keep being smart about these efforts, we can keep moving forward with our rephased openings. I got to stop by the zoo last week to welcome folks back and to check in on our newest additions to the Denver Zoo, the lion cubs. And I'm excited that along with the zoo, our other museums are starting to open up and to welcome people back. That same goes for the Cherry Creek Mall, which fully opened last week. Local restaurants have started to offer sit-down services again, and we're continuing to move outdoor seating options through the approval process, including, as you've seen, First Street closures on Larimer Square and the pavilions along Glenarm. Gyms are also back open with 50% capacity, with up to 50 people in a single confined space. And lastly, for city services that are reopening again for in-person service, including DMV on Monday, dog parks, playgrounds, adult and youth sport camps, you can go to denvergov.org/COVID-19 for a full listing of the openings of city activities and facilities. It's great that little by little, it's a little easier for people to get around and other people to see other people again and to see families. But again, we must, as a city, as a state, continue to take this slow. If we can keep that positivity rate down by continuing to do what we're doing, that's when we can start looking at additional reopenings going forward. But if we start seeing numbers go up again, like seeing a greater than 5% positivity rate, we won't hesitate to call a timeout for further relaxing restrictions. So we're slowly, methodically opening back up. And like our continued response to further mitigating this virus, it's going to be a long haul. We said that from the beginning. Our long-term recovery committee, chaired by former City Council President Albus Brooks and Chief of Staff Alan Salazar, is hard at work planning on how we can emerge a stronger, more resilient city and people from this pandemic. And we've got a lot to tackle. We need to restart the economy and create more support and opportunity for workers. We need to address the gaps in our health systems, especially in our communities of color exposed by this virus. And we need to redouble our efforts to change how we support our residents experiencing homelessness, including more 24-hour options, which has shown to work at the National Western Complex and the Coliseum. I want to share that we are not oblivious to the encampments that have sprung up around our city. These are of great concern. They have the potential to be a slate of very serious public health risks for people in them and the neighbors around them. As a city, we are working to strategize how we can continue to address these encampments. But the bottom line is they have become a public health threat, and we're going to have to clean them up in order to keep everyone safe and healthy. And this all means, we got to do this within the realities of our budget constraints and challenges. We also need to address the changes people here in Denver and across the country are demanding about the future of policing in our communities. We've seen the state legislature take action, and we thank them for their leadership. We as an administration will continue listening, but also are willing and ready to continue the conversations about how we can improve our policing while also being appropriately responsive to our community. This is not going to reduce this call for change. We will not reduce this call for change to a slogan. These systemic challenges can't be reduced to just a slogan. We need to make sure that they are backed by action. But we're not going to ignore people's pains and frustration, and we need to bring down the barriers to that change that are required at this moment. This is truly an extraordinary moment in all of our lives. But we ask people to continue to be thoughtful and prayerful, continue to wear face covering, maintain physical distancing, wash your hands, stay home as much as possible. That's how we're going to continue to move this ball down the field. With that, I'm going to turn it over to Bob McDonald on our testing, to give you an update on our testing and contact tracing.
Thank you, Mayor. As the Mayor mentioned, we are in a good place right now with meeting the metrics that we're trying to achieve with managing this pandemic, not just in terms of the number of tests being done per day, but the positivity rate is well under the state's goal. Denver's a leader in that regard. We continue to operate, to the Mayor's point, our mobile units to go where we need to be to get to those people that can't make it to the Pepsi Center. Pepsi Center numbers are just outstanding in terms of what's being done there. Case numbers, I've been asked recently about case numbers, and we look at, of course, what happens on a daily basis, but we're also looking at 7-day averages and 14-day averages to get a better picture of where we stand over the course of time. And we have seen a little bit of an uptick in the last 7 days, and I've been asked, is that the result of less physical distancing? And perhaps it could be. I think it's a little too early to tell. I think when you look over a longer time span from the date of the first case in Denver to where we are now, I'm not seeing anything outside of that kind of that normal ebb and flow that you see over time. So I think really what we need to look at is what happens over the next 7 days. Does it continue to rise, or does it level off? And so I'm not seeing anything alarming yet, but we want to be extremely careful to reinforcing many of the Mayor's points. We cannot ease up on face coverings at this time. I've been asked about what's occurring in states around us, and why are we seeing numbers uptick around us, but in Denver things still seem to be pretty stable. I think that there's a number of reasons for that. There are some states, I know of one in particular that surrounded us that never implemented a stay-at-home order. There are municipalities around us that eased up on restrictions perhaps a little too soon outside of this state of Colorado, and some that do not have mandatory face coverings like we have here in Denver. So I think with leadership of the Mayor and many partners in the EOC and many other departments, we are managing this very well, but we cannot ease up on where we are. The one thing we don't want to do is lift restrictions and then at the same time ease up on those things that don't have an impact to the economy, such as face coverings. That's a useful tool. And if we can implement that and ease up at the same time, that is the right way to go. We don't want to ease up restrictions and then ease up on face coverings and then have this get away from us and then tighten up again and lock everything down like we had to in the beginning. So we are in a good place right now. I think we're managing it very well. Numbers are stable, and with that, I will turn it back over to the Mayor if anybody has any questions.
Thank you, Bob. Let me share again. We thank everyone who is wearing face coverings in public. This has, without question, in fact, I'll just repeat a good friend of mine who happens to be the mayor of Dallas, I saw him on CNN last night, who took it upon himself to implement face covering in the city of Dallas. This is not a partisan issue. This is not about politics. This is common sense, that when people wear face coverings, you are helping your neighbor and you are protecting one another. And so let's exercise good common sense to keep each other safe from this virus. So I think that's it. We're going to open it up for question and answer. Hopefully we can hear one another.
Mayor, would you like to respond to what's going on outside the building?
You know, I don't know what the chants are. I can't really make out the chants. I hear them, but I don't know what it's about. But let me generally say that we recognize and acknowledge that this is a very difficult time in the life of all of us in this country, certainly here in Denver. And we are not immune from the challenges that have befallen cities all over this country in terms of needing to address the challenges of police force, excessive force, people who've lost their lives at the hands of law enforcement. But I'm also committed to listening. I'm committed to action because we got to remember this is also my home. Denver is my home, and I want it to be a healthy, I want it to be a safe city. And we know this is a position of listening at this point in time so that we can forge conversations forward. At some point, the demonstrations have got to be translated to conversations and dialogue so we can determine what is necessary to advance our city in a more proactive, progressive manner. Yes.
So sweeping unhoused folks is actually against CDC guidelines that were issued. So I'm wondering why the city of Denver has chosen to go against the CDC guidelines for how to interact with these encampments. The CDC says, unless individual housing units are available, do not clear encampments during community spread of COVID-19.
And what you see are encampments that have not been cleared. When we have gone in, we've gone in to clean them from the public health threat. And maybe Bob McDonald can address that a little more. But, you know, you cannot try to guard against one virus or potential challenge, public health challenge, while allowing others to exist. And that's the balance that we have to try to walk. Some of these encampments have, quite frankly, have spiraled into acute public health threats. And there's a great concern when you are allowing feces and needles and other unsanitary conditions to exist, which we have found in some of these encampments. We have to abate them. And so we have not tried to move people. We have gone in, asked for the compliance to allow us to clean the location, and then they were allowed to go right back into where they were in most instances. So, Bob?
Because you've put up fencing. You have moved people. So what is your response to the fact that people actually have been cleared because there has been fencing put up and huge rocks in the places where people have been cleared?
Well, I can't speak to specific instances. I have to ask our public works about it, about those instances where that's occurred. Usually when that's happened is there's also a concern about the location that individuals are sitting in, and they need to go in and make sure they're cleaned up. Again, as we have seen, we have sent public health officials as well as public works or DOTI people, transportation infrastructure folks in. We have found some very dangerous situations with needles embedded in landscaping, and so we've had to abate some of those situations. So I can't speak to them specifically, but I can just talk about some of the general briefing. Bob?
Yeah, I'd like to address that a little bit. First of all, CDC's guidance is just that. And I would disagree that we're not adhering to that guidance. We have had, I understand what it says on their website, but I will share with you that we've also had conversations with members at the CDC. And their response and their guidance has been that we need to balance the public health threats that we see within our community, those that we see in encampments and what we see with COVID-19. And so I'm very confident that the CDC would not encourage us to allow the conditions that I've seen in some encampments. There are a number of encampments that we don't act upon because they don't present the same public health threat that we see in others. So I appreciate your citation of the CDC's website, but we've spoken with the CDC about that, and I'm very confident that given those conversations, we are aligning with their guidance and taking all factors into account and balancing the various public health threats.
Yes.
One of those encampments is around more in middle school, and some viewers' questions have come to us about that encampment that has encircled the school. The questions are along the lines of, what can you do within the scope of the law to deal with that and respect the encampment and respect the neighbors? What can the city do?
Well, I'll remind you that we have a camping legislation or law in place in Denver, trying to follow the guidelines, or at least the suggested guidelines by CDC. We did allow for certain encampments to occur, but again, they've spiraled, and so we have to now use our public health orders that give, indicate that there are threats there to go in and begin to abate those, and we're going to do it. The reality is we cannot allow an unsafe condition to exist for the people who are camping there or for the neighbors around the encamped sites, and so we're working to look at various options and strategies on how we can best abate that right now. Yes, Lance?
You may have addressed this already, and I just couldn't hear it being way back here, so my apologies. But there are some businesses. Are you guys seeing a number of businesses open in Denver fully that really don't have the city's okay to do so? Nightclubs, bars, that type of thing. How are you handling that?
Thank you for the question. The question is, how are we handling situations in which there's non-compliance with public health orders, perhaps businesses opening up prematurely or exceeding the cap that is set under the current public health order. I will tell you that we receive upwards of 100 complaints a week on this very thing, and we respond to 100% of those complaints, usually within 24 hours. So we have a great response time. Unfortunately, we have seen businesses that have exceeded the cap. We generally will follow a escalated enforcement process, starting with education and guidance. And if that doesn't work, we're going to do what we need to do to protect the public, to include issuing a summons to court and forcing a closure. And unfortunately, that's occurred in a few places. But I want to, every time I hear this, I want to take the opportunity to thank all of the businesses who are doing everything that they need to do to protect their customers, their patrons. There is far more compliance than non-compliance, and I want to call those people out and thank them across the city.
I have made a concerted effort to try to get out and visit some of the facilities that have opened up, Lance, and one occasion, my temperature was checked when I walked in the door. Another occasion, I was asked to, not only was it checked, I was asked to sign that here's your temperature. Obviously, been asked to make sure, I wear a mask anyway, but they were checking for masks. I saw people turned away from not wearing masks. So I agree with Bob that for the most part, now that I've been to 4, 5 public restaurants and lounges, people are being asked to comply with. And they're very strict about this distancing as well. So tables are spread out, and they're being
May I
smart.
put a question?
Yes.
Go ahead, Donna.
Hi, this is Donna Bryson from Denverite. And when you talk about addressing the camping issue, is there any consideration to sanction camping where you can control the hygiene, provide services, provide security?
I didn't hear the full question. Can someone
Can you repeat the question, Donna?
go closer?
Yes. With regards to camping and the public health risk that poses, is there any thought to addressing that with sanctioned camping where you can provide hygiene, provide bathrooms, provide trash pickup, provide security?
We're looking at, Donna, she asked about a sanctioned campsite where you provide the services of sanitation and restrooms. We're looking at all the options right now, Donna. Where in the nation and other places have these sanctioned campsites worked, as well as how that might work if we were to have it here in Denver. So we're taking a look at it.
Can you
say whether at this point the city has confirmed whether the protests and demonstrations over the last couple of weeks, did they contribute to a significant spike in cases in the city?
You know, again, I think that it's a little too early to tell. Certainly, there's less physical distancing now than there was a month ago. The protests is a part of that, and of course easing up the public health orders and the restrictions could also contribute to that. It's possible. I can say that generally this virus does not spread as well in outdoor settings, but we still need to have those precautions in place. A little too early to tell. I think the next week or so we will have a better understanding of whether this is a consistent and the early onset of a spike, or if it's just that normal ebb and flow that we've seen over the last couple of months.
Yes, Lance.
Quick question about the big testing site at Pepsi. It's been in operation for a couple of weeks now. What are you, and you may have addressed this again, I apologize, what are you seeing from that testing center?
Well, for the last 2 weeks, we're very pleased to see that we've reached our mark in terms of the average daily testing rate of over 1,100 people per day. That's good. I think this past weekend we broke a record in terms of almost 1,400 people being tested on the site. That's good. Our positivity rates are below 5%. That's even better, and we want to continue that rate. We want to continue, and if you all can help us spread the word, continue to encourage people to go get tested. It's open daily from 8 to 4 at the Pepsi Center. It's free. It's quick. We ask them to pre-register at denvergov.org. That's primarily to allow for the facilitation of an efficient process of going and being tested so that we don't have to get you registered while you're there. It just helps to keep the flow moving along. But yeah, it's there, and we are seeing good rates. Bob, you may want to, Dr. Rowan, if you want to share, but we are seeing good numbers. And again, I remind folks, we are also starting to go into neighborhoods where most vulnerable people live, or people who might be more, impacted by COVID, and that's helping as well. We're seeing anywhere from 100 to 300 people being tested at those sites when we set them up on a Saturday.
Do you want to speak to that?
Yeah, that's exactly right. So, the numbers only tell part of the story, and what we need to do is drill down on the numbers and see if that means that there are disproportionately impacted neighborhoods or how people are doing in congregate settings. So we have a community testing program, and it's in partnership with Denver Public Health and DDPHE and the city. And we have now tested about 2,000 people in neighborhoods and in shelters and congregate settings. We have also tested at encampments. And I feel like this is going to be really a key way that we keep our city from seeing the increases, by really bringing testing to people who can't make it to the Pepsi Center, who might not have a primary care provider, and who are really disproportionately impacted.
I'm going to ask Britta Fisher, if you would. Britta, come to the microphone. I think there are obviously a lot of questions about homelessness in the city, and Britta Fisher is our Chief Housing Officer. I think it might be good just to talk about the strategies going forward.
Thanks, sir. Britta Fisher, Executive Director of the Department of Housing Stability. And I just want to say, with my colleagues here, we have the Director of Public Health, and we have Director of Emergency Management, how heartened I was to be part of the city team, where when we were in the early days of this emergency, the question was, how can we serve people who have the least? And I really appreciate the emphasis on how we could create those resources. And so a couple of the things that occurred as part of the early response to people experiencing homelessness included auxiliary shelters. When you look at the scale of what we were able to put together, it was from the homeless service provider community, the shelter providers, coming together and saying, how can we create more space to serve people? How can we integrate health care? How can we do the things that we've wanted to do in our strategy, like around-the-clock sheltering, and make that happen? And it was incredible to be a part of that and see that happen. We have had 1,065 beds through the auxiliary shelters, and we have served over 180,000 meals at that site, both the Denver Coliseum and the National Western Center. And so it's been incredible to see that more people are accessing shelter. Our recent survey showed that there were 16% of those surveyed just 2 weeks ago who said that they had been sleeping outside previously, but they were accessing this around-the-clock sheltering. And so we do see people coming in. It doesn't mean that we are blind to people being outside and in encampments and sleeping rough. We continue to work on a housing-first strategy, and we have 1,021 units of financed housing right now that is in our pipeline to be contracted. We have 1,066 units that are to have groundbreaking in the next year. So is that something? Absolutely. Is it everything? No. We know that we need to do more, and we continue to work with all of our partners, including this federal resources that we have available right now, to leverage the best possible outcomes that we can. It is a budget-constrained environment, and yet I've seen Denver continue to invest in these strategies to help people experiencing homelessness and those facing housing instability.
Thank you, Brett. You had a question over there?
Yeah, this is Jesse Paul, the Colorado Sun. I had a question. Other communities in Colorado have seen problems with young people gathering and coronavirus cases increasing because of that. I'm wondering if Denver has seen anything similar.
I didn't hear the last part of the question.
Have we seen that here in Denver?
Oh, have we seen that here in Denver? I don't, Bob?
Yeah, I'm not sure I heard the first part of the question, so maybe repeat the whole
He's
thing.
referencing young people congregating in public locations,
Yeah.
beaches, nightclubs,
Yeah.
and violating social distancing regulations. Have you seen any of that here in Denver?
Well, certainly there's been some of that. To my earlier comments about seeing some level of noncompliance, we do get those concerns called in through 311 to the Department of Public Health and Environment. And as I said earlier, we respond immediately to those and provide guidance and try to abate those issues. I think the short answer is yes. We've seen some of that here. Denver's not been immune to that, but we've addressed it quickly and continue to respond to those concerns when they come in.
Sounds like there was another question. Can you repeat?
Do you want Jesse or do you want me? I'll go. Steve Steger from 9 News here, Mayor. I have a question for you regarding some of the things you're hearing right now. This one's about the Christopher Columbus statue in Civic Center Park. I'm curious how you feel about that statue. Should it be removed amid the calls to remove it? And what process is the city going through right now in regards to that statue?
Well, we are right now working with the Arts and Venues to take a look at the history of that statue. As you know, Steve, it is not a statue of the likeness of Christopher Columbus. It was named by the artist Christopher Columbus. It is actually meant to replicate another piece of very famous Italian art whose name escapes me at this point in time. So we've done some research on it, and so we are looking at what our options are per the gift, because it was a gift to the people of Denver, in terms of removing the plaque or renaming the piece of art. But we're looking at various options around that piece of art. I'll remind you that last week I also announced that I have asked the Commission on Human Rights and Community Partnership to serve as a naming commission for various facilities, parks, monuments in the city of Denver, to do and to work closely with the state of Colorado to do as much research on those pieces that we believe may be offensive to people, and to determine what our steps ought to be, whether renaming them, removing them altogether, but what options we should undertake. This is a commission that represents the diversity of our city, various different demographics and affiliations, and I'm excited that they're going to lead the effort along with two members of City Council, both at-large members. So we don't take this seriously. We don't take this lightly. This is a very serious issue, and one in which not only must we create spaces where people feel accepted and respected, but we also find ways to provide that opportunity for people to understand the history of certain monuments and why they existed in the first place, but why they also need to be removed or renamed. There one more question online? I thought there was one more.
Any more questions?
Mayor, if you could please answer a question about the fireworks. Is there anything being done in the city to address the number of fireworks that are being
popped every night in Denver.
You know, obviously it's illegal to have fireworks in Denver. We are seeing a national phenomenon, by the way. This is not just Denver. It's all over the country. I was on a line with the mayors this week, and every mayor is saying this is one of the most difficult rules to enforce because by time law enforcement shows up or once it falls within the priority tree, the fireworks or whoever's doing the fireworks are gone. But it is disturbing and disruptive to people who have them. But we will continue to try to enforce the law. I mean, that's the reality. It's just a very difficult law to enforce. I don't know if the city attorney or the Chief Payson may want to respond to it, but I do know it's something that we're being. Chief, you would like to come and address fireworks?
Thank you all. Yes, we recognize the increase in calls for service. Our officers have responded to many of these calls. In fact, in the last 2 days, we've gotten a couple of 1,000 pounds of illegal fireworks, commercial grade fireworks off our streets. It was a very dangerous situation. Our bomb squad responded on that call. We'll continue to address that. We want compliance. We seek compliance. We hope that people can recognize that we have people that have PTSD, that sometimes illegal fireworks can trigger these types of issues, and then also dogs, including service animals, can be negatively impacted by this. So again, we seek compliance from our community, and these large-scale commercial-grade illegal fireworks will continue to address.
Can you talk about that? Last night the windows in my home were rattling. I don't know if that happened to anybody else, but commercial grade fireworks, what are you talking about?
We're talking about the fireworks that leave the ground and explode. That leave the ground and explode. Thank you.
And they are serious. I have a 14-year-old dog who can barely hear. I can be standing right next to her. And there was a firework that went off near our home, and she stood up on her feet. It rattled all of us. This is serious stuff, and I know it's disruptive to neighbors. Again, we remind everyone that these are illegal. It stresses it further stresses the law enforcement that's trying to respond to other calls, and it's disruptive to the peace and quiet of families around you, and to be mindful of that. We just ask people to be mindful it's illegal, and when we are able to find those who have them, as the chief pointed out, not only are we going to confiscate them, but you could be subject up to a $999 fine in the city of Denver.
Mayor, one more question about the Moore Middle School campus. What's the timeline on that, or can you give a timeline?
No, I can't give a timeline. I'll be very, candid with you. There have been attempts to go in and help clean up some of these sites, and we've had people who have stood as barriers to the sites themselves. We're trying to avoid that type of engagement to keep our public employees safe and healthy, keep our members of our community who are experiencing homeless safe and healthy. And we don't need that type of engagement. Just know that these are under public health orders. We are trying to help folks who are homeless. We're trying to help the community around them. And we're going in with great risk as public officials to clean the sites up and to help those. And we want to help them. It's easy to demonize the government when we are trying to do what we can to create balance, give access to services, and to help folks. But in reality, that's what we're trying to do. We are not trying to hurt our neighbors who are experiencing homelessness. And I want people to hear that loud and clear. If we get to individuals, if we're able to help them access services, we have a greater probability that they're going to move to a more stable lifestyle, one that's healthier and safer for them. And I believe in my heart that we have to continue our efforts to do that. Britt and her team have been working around the clock. No city has stood up the kind of congregate care that we stood up as quickly as we stood it up at the onset of this pandemic. We'll continue our efforts to do everything we can in a way that allows us to appropriately service people who are experiencing homelessness and to get them access to services. And anything short of that, I find, inhumane in terms of saying it's okay for you to exist in this condition and to subject the rest of neighbors to it, because we can do better and we have to do better and we want to do better. Thank you all.